Addressing Complex Needs, User-Centric Design to Enhance Wellbeing. The research is based on the work of a number of people who are part of our team. We are working on a way to develop a means to make policy based on the perceptions of what works, why and how, and conversely, what doesn't work. And we are very interested to test out a hypothesis, namely that if people are involved in the process of participation in decision making, it is much more likely that the fit between services and outcomes will match or be closer to their perceived needs. So our research informs an understanding of how people perceive local challenges with a view to scaling up evidence-based policy to enhance resilience to cope with social, economic and environmental challenges. The work that we're doing spans a number of disciplines. It is very much a transdisciplinary project. We have members who are in governance and public management. Denise de Vries, who is in informatics, mathematics and engineering. I lead the project that was funded by the Australian Research Council and is now funded by the CRCAH along with Denise de Vries to develop and scale up our interactive process. We were assisted by Associate Professor Doug Morgan, who was the chair of Neparendi, the organisation that kindly supported the project initially along with the South Australian Department of Health and Human Services, and is now being assisted by Families and Community Services, as well as a number of small government departments addressing things like housing, domestic violence, and a number of interrelated needs that surround social inclusion. Others who've contributed to the project are Kim O'Donnell as mentor, and her experience and understanding of Aboriginality has been very important. Professor Anne Roche, whose expertise in public health has certainly helped to inform and shape the initial stages of the project, which was invaluable, as was the input of Professor John Roddick, who managed to find for me the wonderful assistant Denise de Vries, who then became a leader on this stage of the project. Professor Tony Walters, whom I met in Hong Kong at the Consciousness Conference, has been marvellous in helping to make the Second Life environment in which we are working at the moment as a means to explain how to use the interactive software, and Bevan Wilson, who is a senior lecturer and mentor at Unger-Rendi. So those are the people who've been involved in the project. Now, what is the project about? We need to address complex health, housing and social inclusion issues, and it is very difficult to address complex, wicked problems that have many variables that are interrelated and that have a value dimension if you work in silos. So it's all very well for governments to say that we need to do whole of government approaches, and we need to coordinate across government departments, and we need to work across the public and the private sectors and with voluntary organisations. But very often this rhetoric remains just that, because departments actually find it very difficult to translate this inter-organisational work into practice. And that's what this project is about. The message is that it's possible to do things differently, and that we say that well-being is an idea whose time has come, and this has implications for policy and practice. And we also stress that participation helps to match policy with practice and that it enhances mindfulness. So the idea is that if, in fact, we can use the transdisciplinary research to address health, housing, education, employment within livable cities, then we will be able to address social inclusion, and we will be able to address the enormous challenge posed by climate change, which will impact on our way of life. And what we are trying to look at are the big issues of human well-being and security. For a long time, we have looked at the global commons as narrowly defined as assets outside the national frontiers, such as oceans and space and the Antarctic, which is what the OECD used to define it as. But now, this definition is reworked in terms of our approach so that we concentrate on the common good, and we argue that, in actual fact, the global commons and quality of life provide the basis for well-being, and it is defined in terms of quality of life, and that this is the underpinning of well-being. Being able to live to the end of a human life of normal length, not dying prematurely or before one's life is so reduced as to be not worth living. Being able to form a conception of the good and to engage in critical reflection about the planning of one's own life. This includes employment outside the home and to participate in political life, being able to show concern for others, being able to live a life that is concerned about and in relation to animals, plants, and the world of nature, being able to laugh, to play, to enjoy recreational activities, to live a full life. And Forgerer, who launched the policy document for the Public Health Advisory Committee in Wellington, New Zealand, has stressed that the report, Wellbeing is an idea whose time has come, is important, that if we are going to do anything to improve health and well-being, we are going to have to work across boundaries. And when this report was launched in 2007, it was very timely, because soon after that I gave a plenary address at the Australian and New Zealand Systems Sciences in Auckland, and the Maori notion of well-being, of course, resonates very closely with the Aboriginal notion of well-being. And the point that has been made by Aboriginal Australians and also by Professor Fiona Stanley in the Hawke Oration is that the kinds of challenges that the most marginalised in the community in Australia and elsewhere are facing, those challenges of homelessness, social exclusion, unemployment, and a poor quality of life, are likely to be challenges that are going to be felt much more widely, because climate change will affect the standard of living that is taken for granted by the privileged. And so this is the challenge that we are looking at when we address the challenge of livability in our cities. When we are looking at well-being, it is not just the well-being of the other, it is the well-being for everyone, and our concern is for this generation and the next. That notion of the boomerang effect, what we throw out, we will get back, is central. That feedback loop underpins our systemic understandings.